Hello and greetings to one and all to the deaf and hard of hearing community of Rhode Island. Welcome back. If you recall 3 years ago, back in January of 2020, when the onset of COVID-19 first hit the United States, the federal government quickly made a public health emergency declaration where they had established certain guidelines that we had to abide by. And we've been abiding by those for the last 3 years. Well, now this is the good news. It was just officially recommended by the CDC, Center of Disease Control, on May 11th of 2023, that this declaration is now non-existent. It has been terminated. And the World Health Organization, known as WHO, prior to May 11th, conceded and also abided by the same recommendation that COVID declaration was to be terminated. However, people may think that because declaration is terminated, that COVID is non-existent and we can party. That is not the case. The existence of COVID is still in existence and still impacts many lives. Okay, so, but the numbers have gone down tremendously. Since January of 2021, the deaths resulting from COVID-19 have gone down 95%, and hospitalizations have gone down nearly 91%. Plus, there were other numbers and statistics that were taken into consideration to make this determination to terminate this declaration and considered it safe to do so. And the reason why that they did this was really is that the expense that was covered by the federal government for free vaccines, free testing, free treatment, and so forth, that was all free. That is no longer the case. This cost now has been returned to your insurance companies or Medicare or Medicaid. They will now pick up the tab going forth, and they will be liable to cover some of these costs, and some of the costs may be covered by the government. The government wants to remind people that there are 4 important things to remember going forth. And that is that COVID is non-existent. That is not the case. They want you to be aware that it is existent and you can still contract it and you can still die from it and you can still get sick from it, either or. It is important that you follow the CDC recommendation guidelines that are in existence today in terms of keeping up with your testing, getting treatment, keeping up with your vaccines. And if you are to get contaminated, you should isolate yourself and quarantine yourself. Keep in mind about traveling. When you're in airplanes, buses, and trains, and you're around a lot of heavily congested populations, you should wear a face mask. Now, there are 3 categories of people that are considered at high risk for contracting COVID-19. The first category are people who are 65 of age and above. They are considered high risk. The second category are those people who are immunocompromised, meaning people who have underlying diseases, okay, such as cancer, or just had some type of major surgery, or they have some type of disease. They need to be extra cautious. And those who are pregnant, to make sure that they do not contract the virus as well. And lastly, as I just explained, your health insurance plan is now going to go through some changes. So you need to check in with your insurance company to follow up to see what is covered and what is not covered. More will be explained on that at a later time.